Well, we're excited. We're presenting the results of ZUMA-9 here at ASH 2020. Really, there's two cohorts to ZUMA-9. The first cohort was really an expanded access cohort prior to the regulatory approval so that patients could receive axicabtagene, ciloleucel, or axi-cel for the treatment of refractory large B-cell lymphoma. The second cohort is a slightly different twist. So when we treat a patient with axi-cel, we first apherese the patient, collect their T cells or mononuclear cells to be made into axi-cel. The gene gets put into the T cells. It makes a CAR T cell therapy product, and it's shipped back. Those CAR T cells have to undergo some release criteria. They have to have a certain amount of interferon gamma released when they're co-cultured with target cells. They have to have a certain viability and transduction efficiency of the gene that's put in. And so cohort 2 of ZUMA-9 is for patients who they were enrolled for commercial or standard of care axi-cel, but their product doesn't meet the specifications allowable by the regulatory agencies. So rather than just throw out that product, they get enrolled on this study and they're able to receive that out-of-spec product. And what we find in that cohort 2 for the out-of-spec product patients, with 36 patients that receive that treatment, the objective response rate is 53% and the complete response rate is 36%. So slightly less, but similar in the similar ballpark to what we saw in the pivotal ZUMA-1 trial of axi-cel for the same group of patients. And with a median follow-up of 13.2 months for these group of patients in cohort 2, the median overall survival has not been reached. And so really what this tells us is that if we have a patient, we're expecting to give axi-cel and we get word that it doesn't meet the specifications, we can still give them the product safely and effectively on this ZUMA-9 protocol. And it may lead, hopefully, to eventual increased regulatory agencies allowing for a broader release criteria so that these patients can actually get the therapy not on clinical trial. One thing we did observe, and the toxicities were very similar to ZUMA-1 in the same range. One thing we did note is that the CAR T product manufactured in these patients tended to have fewer naive-like stem-like T cells or CCR7 positive cells. And actually, after infusion into the patient, they didn't expand in the blood quite as much as we had seen on ZUMA-1. So it may be that these patients had more prior treatment or their starting T cell material wasn't quite as good, and yet we're still able to manufacture a usable product and get these patients treated. We need more follow-up to see how durable these responses are, but the ZUMA-1 durability is quite impressive. So we're pleased to present that data.